China is battling a new and rapidly spreading respiratory virus. The number of people infected has tripled to more than 200, and President Xi says it needs to be resolutely contained. Now, the virus first appeared in Wuhan in December. The authorities say it passed to humans from animals at this food market in the city. But if it began in Wuhan, then there were cases recorded in Beijing, Shanghai and Shenzhen. We also know South Korea and Japan have confirmed one case each, and there are 2 confirmed cases in Thailand. 3 people have died from pneumonia, which has been caused by the virus. Well, we had this update earlier from the China National Health Commission confirming the virus has passed person to person and has infected some medical staff. We also heard from the spokesman for the China Foreign Ministry today, who called the outbreak an epidemic. Well, the virus is understood to be a new strain of coronavirus. Here's one expert to help us understand that.
Coronaviruses come in different forms. They can be as mild as just causing a common cold, but SARS is also a coronavirus, and those of us who work in public health have a sort of reflex fear when we see that a coronavirus is emerging.
Also today, the World Health Organization says it will convene an emergency committee of what it calls the novel coronavirus. That will happen on Wednesday, the 22nd of January, 2 days' time. Now, the WHO isn't recommending any restrictions on travel or trade, but it does have some advice if you're in affected areas. That includes clean hands with soap, water or alcohol-based hand rub, and it says avoid unprotected contact with wild or farm animals. Now, next I want to show you this, because for the last week, China has been using these infrared thermometers at airports, railway stations and coach stations in Wuhan. Passengers with fevers are being registered, given masks and taken to medical facilities. But there's a challenge. Here's another expert on why it's much easier to identify people who may have the virus when they're on the move than when they're in their hometowns.
If you study international travellers, which is one thing we've done, it's easier to see the cases because it's a small number of people, you can test them, you can screen them. Actually, on the ground, the priority is to give good information, accurate information. So agreeing a case definition and testing all those many suspect cases is far more difficult.
Well, next let's hear from Dr. William Schaffner, an infectious disease specialist, on another challenge this new virus is posing.
We don't know, for example, yet whether people infected with this virus who have only mild illnesses can spread it. At the moment, we have a story of a so-called super spreader, a person who was in the hospital who spread it to, as I understand it, 14 healthcare workers. Whether that's common or uncommon is still not known. So exactly how contagious this virus is, person to person, is still a bit of a mystery.
Now, in its editorial, China's state-run newspaper, the China Daily, which you can find online as well, and this is the Global Times too, has been telling the public to remain calm and analyse the situation objectively. Other official media today is circulating with guides to help people avoid catching the virus. This one, for example, we know is telling people that some people are panicked about the illness, but there are 9 pictures to help people understand it and presumably stay a little calmer. This one mentions the symptoms of coughing, a headache and a fever. It also goes on to say, look, this virus is not SARS or MERS. SARS was also a coronavirus that killed more than 700 people back in the early 2000s. So that's the official story. Let's find out what else is being said. Kerry Allen is a China media analyst with BBC Monitoring. She's live with us now. Hi, Kerry. How much information is available about the virus?
Well, at the moment, not a lot, because there's still an investigation going on as to what exactly this virus is. So this has been one of the big questions that's been coming out online amongst people. I mean, at the moment, a lot of people aren't working. They're traveling home to see their families for Spring Festival. And so they're asking a lot of questions online. They're asking, can it be transmitted person to person? Do I need to take extra precautions? Should I even stay at home? So there is a lot of fear coming out online from people throughout China, and especially today, now that cases have gone beyond Wuhan in a central city in China to other major cities like Beijing and Shenzhen and Shanghai. So these are big cities with a huge population and a lot of people traveling through.
Well, I was going to ask you about the number of people traveling. Is the fact there are holidays around now meaning that there's a greater problem containing this virus?
Yes, absolutely, and that's been one of the biggest criticisms online. So when the travel season begun, it was announced that there was an expected 3 billion journeys that would take place this year in China during Spring Festival. So that involves plane, train, everywhere. Everybody travels during this period. And when cases started coming out in Thailand, South Korea today, and Japan, people were asking, well, how come we're only hearing about cases in Wuhan? So there was also questions online from people about whether there were cases that the government wasn't necessarily releasing yet. So that's today been one of the big talking points, now that beyond Wuhan, we are hearing about other cases.